All of a sudden, I felt a tremendous wave of fear for no reason at all. My heart was pounding, my chest hurt, and it was getting harder to breathe. I thought I was going to die. I was having a panic attack. Hello, my name is Jaclyn Jones, and I would like to inform you that panic attacks are a serious health problem in the United States. According to the National Institute of Mental Health, at least 20% of adult Americans will suffer a panic attack at some point in their lives. About 1.7% will develop full-blown panic disorder, twice as often for women than men. The peak age at which people experience their first panic attack is 15 to 19 years. Panic attacks are real and emotionally disabling, and sometimes mistaken for heart attacks. No one knows what causes the panic disorder. Research suggests a combination of biological and environmental factors, including family history, stressful life events, drug and alcohol abuse, and thinking patterns that exaggerate normal physical reaction. It is difficult to describe true panic to someone who's never felt it. Try to call to mind a time when fright took over your entire body, such as stopping and rocking at the top of a Ferris wheel, or being in an airplane and experiencing turbulence for the first time. When I experienced my first panic attack, it came out of nowhere. My mind and heart was racing. I became extremely hot, short of breath, and I thought I was going to pass out. After a trip to the emergency room, the doctor told me I was having a panic attack and gave me a pill to help me calm down. I remember thinking, seriously, that's it? They must have missed something. Eventually, I accepted it, began therapy, and found an antidepressant that worked best for me. It has been over 2 years since my last panic attack. Today, I would like to describe to you the symptoms, treatments, and how to cope with panic attacks. Let's take a look at the diagram to help us understand how this vicious cycle works. First, you start with a symptom, which then produces the question as to why, which causes anxiety, which then produces the fight or flight response, which then causes more symptoms, which produces the question as to what is going on, which causes more anxiety, which causes more fight or flight, which causes more symptoms. Panic attacks are truly terrifying and can happen without reason or cause. They can cause extreme nervousness for 10 minutes or more. Physical symptoms intensify the attack, such as sweating, racing heart, rapid pulse, difficulty breathing, feeling faint, and my favorite, going crazy. According to helpguide.org, over time, many who suffer panic attacks will develop an ongoing fear of having another attack. This fear can dampen daily activities and overall quality of life. Some people develop phobias, such as refusing to leave their house. Over half of the people who experience a panic attack suffer from depression, so suicide is more frequent. Now let's talk about the treatment, which can prevent panic attacks or at least reduce their severity and frequency, bringing significant relief to 70 to 90% of people with panic disorder. As Rosenbaum noted in his book, Panic Disorder and Its Treatments, psychotherapy, also called talk or behavioral therapy, is considered first-choice treatment when dealing with a panic attack. Several antidepressant medications can also reduce the symptoms, as well as depression, but is more effective if combined with therapy. Also, you should avoid caffeine, alcohol, and illicit drugs, as these can trigger and worsen the attack. If you can't get rid of panic attacks completely, you can learn how to cope with them. As Lee noted in his book, Coping with Anxiety and Panic Attacks, by using breathing techniques, muscle relaxation, visualization, exercise, and attending support groups, you can decrease the intensity of the attack. If left untreated, anxiety may worsen to the point at which the person's life is seriously affected. I would like to end with a story about Barbara and the panic attack she had on the Golden Gate Bridge. In the book, Overcoming Anxiety, Depression, New Ways to Regain Your Confidence, I had just passed the toll booth and entered onto the main span of the bridge when traffic came to a complete stop. I had not counted being stopped dead on the tracks, with cars and trucks walling in on all sides. My first sensation was my face and neck becoming extremely hot. Scary thoughts flooded my mind. What if I need medical attention and no one can get to me because of the traffic jam? What if traffic begins to move and I cannot drive my car? What if I have to abandon my car and lie on the ground? These circumstantial thoughts were joined by quickly rising terror at what my body was feeling. I tried to talk out loud to calm myself. Perhaps a minute passed in this full-out panicked state. Finally, the storm began to subside. Within a few minutes, I was left pale, sweaty, and shaken, but able to steer the car off the bridge once traffic began to move. Like Barbara, many of us have struggled with or know someone who has suffered from a panic attack. So as you can see, dangerous or not, panic attacks are pure hell to endure. Hopefully now you can recognize the symptoms, treatments, and how to cope with panic attacks. By seeking treatment with a combination of psychotherapy and antidepressants, most people are eventually able to resume normal activities. Thank you all for listening.